Let's talk about the role of a caregiver. First of all, what is a caregiver?
So a caregiver is, as the name suggests, somebody who takes care of someone. And as you rightly pointed out, that might be a role that you choose to take on because it is your loved one that has been diagnosed with cancer. You want to care for them. That's not always the case.
Yeah.
Sometimes by virtue of your position in society or your position in the family or the community, the role is assigned to you and you have to take on that responsibility. And it's a massive responsibility caring for somebody's health, ultimately. But so often the caregivers feel responsible for the person's health. You know, you've been assigned someone, you know that they're not well, and you're trying your best to help them through this impossibly difficult situation. And so you take on that extra burden of feeling responsible for them and sometimes feeling completely inadequate because you're not healthcare trained, because this is not where your life was supposedly going. It's something that you have to try and get your head around. So often there's a massive amount of emotions that are associated with this new role that you find yourself in. Terrified, overwhelmed, blessed, frightened, alone. And so it's okay to acknowledge those emotions, and it's okay. It's all right not to have all the answers. It's okay that you don't know how to be a caregiver because you will learn as you go along. It'll become easier. Ask for help. That's the best advice I can give. Ask for help. You don't have to do this all alone. You can reach out for others to get advice, to find out how they would manage a similar situation. That's okay.
One of the most important aspects is being present, I would imagine. You know, it's not...
Being present, pitch up, be there.
Yeah, be there. Even if you don't know what you're doing, just being there is so important.
Because your role is about support. And it's support in so many different ways. For example, helping with providing a meal. Or perhaps helping with cleaning up the house, if that's necessary. Doing some gardening, washing the car, taking the dog for a walk. There's so many different roles that you can assist supporting that person through their journey. It doesn't just have to be about the physical care of the person, grooming the person, washing the person, helping them move from one place to another.
And it also doesn't just have to be you. It can very easily be roles that you help assign to people. You've mentioned a couple examples, very few. You don't have to walk the dog and make the food and be the support structure and be the emotional barrier, and we can find others that are wanting to help. Everyone wants to help. A lot of people want to help. A lot of people want to have some way of reaching out and showing that they support.
It's a question that comes up quite often. My best friend has just been diagnosed with cancer. What do I do? How can I help? What is it that I can do? I'm feeling so helpless in this particular situation. So step up, offer help. Try and speak to the other potential caregivers that are around, the other support structures, the people in that support ring, to say, how can we work as a team together to help this person that we love so much? What roles can we assign each other or ourselves to make this work for them? And perhaps I'll put my hand up and say, I love dogs. I'll take the dogs for a walk. I'm committing to do that every single day. And you might say, well, you know what, you're pretty good at driving. So, you know, I'm stepping up to say, I'm going to take on the role of driver, and I will drive this loved one to the appointments, to the hospital, help them shop. You know, one of our friends in the group typically is probably really good at gossip. So that's something so wonderful to have. That's my role. I'm going to banter with my loved one.
Because life goes on, and sometimes you don't want to be dealing with cancer.
Don't just want to be thinking of cancer all the time. Let's just have some light-hearted, inconsequential banter chat. And just hearing normal life, normal activities is actually very therapeutic as well. So there's different roles that can be assigned to different people. As a primary caregiver, that's generally the person that's most often around. Perhaps that person will coordinate all of these various roles. And again, just remembering that you don't have to take on everything yourself. It's not possible to take on everything yourself. You've got to have time out. And that's another thing that perhaps we need to discuss as well is if you keep on just being there and taking on all of this responsibility or so-called responsibility and being there all the time, it's exhausting.
Mm.
So if you're not looking after yourself, how on earth are you supposed to look after somebody else?
Mm.
It's just not possible.
Yeah.
So taking time out to go and have your hair and nails done, or taking time out because, in fact, you want to go and carry on with your own life and your own activities, that was always part of the plan.
So you need to look after your own well-being before you can look after other people. As much as you need to be there for them, that shouldn't ever become your sole focus.
It is absolutely not. No matter how much you love that person, you can't sacrifice your own life at the danger of then not doing very, very well yourself emotionally. There's no ways that you're going to be able to be that strength for your loved one.
Step one of the caregiver cycle. I have maybe maybe I haven't even been given the role of the caregiver yet. Whatever the case may be. Step one, obviously, I would imagine would be opening up channels of communication. Something as simple as actually asking that person if they are willing to help you, because you don't necessarily also want someone that's in that position who's not willing to be in that position, because the support that you're going to receive is going to be less. So maybe the first step would be, would you be willing to help me walk this journey? Would you be willing to help me in this specific instance?
It goes both ways. So as the person in the situation,
Good point, yeah.
as the person that's actually diagnosed with cancer, asking the person if they would be willing to help, but equally so, as the caregiver wanting to give my help, is going to that person to say, do you need my help? Is there something that I can assist you with? That's kind of an important question as well.
Not just assigning yourself, because maybe the person that's having the treatment doesn't want you. So it's a harsh way of
It's a
looking
little
at it.
difficult. But you know, one of the important things on this cancer journey is to be able to surround yourself with people that are positive, that have a sense of humor. I've read so many articles that talk about the importance of a good sense of humor. And it's a terrible thing to say, we talk about tumor humor. Tumor humor is actually something that, you know, if you can laugh at it, you can sometimes live with it a little bit more comfortably.
Yeah.
And so to have people in your support structure that obviously they're serious and they're very committed to help you, but they need to be positive and energetic and really, really have your interests at heart, remembering how important it is for their own interests and their own health and well-being to be taken care of as well.
Okay, so finding the appropriate person to be a caregiver, having the appropriate mindset as the caregiver,
Or several people.
is one of the very important factors before you've even started caregiving.
I don't think finding a caregiver is like a step-by-step process. It's really not. It's got to be something that just naturally evolves. And again, it's something that, you know, if you're put into that situation of being the caregiver, when you didn't put your hand up for it, but that's what you've got, you know, that's sometimes a massive problem as well, and how to deal with that situation. So it's not always, you don't always have the luxury of saying, well, I've got all these people around me and this one's going to do that and this one's going to do that. Sometimes you've only got one person, and sometimes you're lucky to only have one person. And, you know, we're very, very grateful for that. The big thing is you've got to be able to support a person that's going through a crisis in their lives.
Okay, so I'm a caregiver. I'm been assigned this role, whether I want it or not. I'm a caregiver. What's important for me? So you've been a caregiver many times in your life. You've got so much experience with it. What were the difficulties that you felt? So not necessarily how to be a caregiver or how to look after those people, but what were the difficulties that you specifically struggled with?
Best one I can tell you about is boundaries. Where are the boundaries? Where's the boundary between me and you? Because it's so easy to just immerse yourself in the role. And because you're a nice person and you're kind and you're generous and whatnot, so you give everything you've got to that person and you lose yourself.
And lose your relationship?
You often do end up losing not only that relationship, but other relationships as well. And that's dangerous because you can't be an effective, efficient caregiver when you begin not to exist anymore, because you matter. You matter just as much as the person that has cancer, and you have to look after yourself.
Yeah.
You have to take care of yourself. You have to have time out. And so the boundary needs to stay visible,
Yeah.
and in fact, and it's absolutely okay to say, oh, I need to catch my breath. Somebody else to take over and just go and be you and be light and frivolous and joyful and enjoy and be allowed to enjoy your world without cancer for those few moments, because otherwise it's just so dark. It can get dark so easily.
So maybe trying to keep the boundary of what your relationship is as static as possible as well, or at least not as static as possible, but the boundary of your relationship being, this would be the time that we can talk about cancer, and this is the time that we can talk about us and our friendship or our marriage or our whatever that relationship is.
All the challenges of the day that present themselves, that could work as well.
Okay, so boundaries are hugely important.
Boundaries is
Setting boundaries.
Second one that I've found that is incredibly important to always remember, and we've mentioned it a few times, is caring for yourself as well. And so many people say, oh, but that's selfish. I can't do that. It's not selfish at all. You have to be able to take care of yourself and show yourself self-kindness and compassion before you're able to give it to other people. And it's taken me about, I don't know, 30 years of nursing to learn that lesson, is that you have to, first of all, be kind to yourself before you can be kind to others.
So boundaries and being kind or caring for yourself are two of the big ones that you've experienced through your time. What else?
Sense of humor.
Yeah.
Being able to laugh at things, to be able to communicate with the person that you're caring for, communicating with other people in the caregiver roles and support structures, communication with the healthcare providers and the healthcare team, the doctors, the nurses. That's massively important because you're getting a lot of information from them as well.
Yes.
And being able to hear that information and be able to interpret it or to repeat it for the person that you're caring for is one of the roles that you have to take on sometimes.
Yeah. So making sure that cancer doesn't become your whole life. Cancer is one pillar of, it's a small part, and don't let it filter into other things. So the boundaries, and then even when you are dealing with cancer or talking about cancer, supporting someone with cancer, doesn't have to be serious. There will be serious moments, sure.
Oh, yes.
And it doesn't matter how easy or tough your journey is, you're going to have serious moments. But there is also the possibility that it doesn't always have to be serious. It can still be approached with levity.
I think those are beautiful words that you've used. I really do think so. I think it's okay to have those moments of serious conversation, whatnot, and then say, right, moving on, let's continue. And that sometimes gives permission to the person. It edges them along with some gentle encouragement to say, don't stay in that dark place. Come, let's go. Let's keep on moving. Let's keep on living. Let's keep on living with cancer. Let's keep on fighting cancer.
So putting a full stop to a conversation or to a situation is also I would imagine, one of the very important things. A piece of advice that my father always gave me: when you arrive home from work, go for a run or go for a walk, because that puts an end to the day.
That boundary.
Yeah, so I've arrived home from work, I've worked 8 hours if that's your job. By not ending my day, my work day, I carry on thinking about it. Maybe I just sit down in front of the TV or whatever the case may be. I carry on working in my mind. My stress level works for 10 hours, 12 hours. End the day. Similarly, end the situation of cancer if you're having a conversation about it, right, moving on, end it there so that it doesn't linger in your relationship afterwards, or it doesn't linger in whatever it is that you have planned for the rest of the day. What about grief? What happens as the caregiver's role as we start approaching a prognosis that is not positive? As we start approaching those really, really difficult times where we're coming to end of life, we're maybe tending on palliative care, we're maybe just incredibly, incredibly ill or sick, and the grief that's around that. Obviously, we're starting to talk about the psychological aspect largely, which is a huge pillar of being a caregiver and your support group. What are some of the pitfalls that you've experienced in that
Wow,
arena?
that's a big subject. I think you have to acknowledge your feelings. You have to acknowledge the feelings that I'm so out of my depth here. I'm so frightened. I'm terrified that this person may die in front of me. I don't know how to handle things. I'm so frightened I might miss something.
Not just as the caregiver, but as the loved one. I mean, if I was doing it to you as my mother, you know, I'm worried about losing my mother. I'm not worried about losing a cancer patient. It's a whole different form of grief. So I'm dealing with my grief and your grief. That's a very full plate.
Reaching out to other people. You don't have to do this alone. You reach out to people whose specialty it is in those situations and you ask for help.
Yeah.
You ask for help not only for your loved one, but you ask for help for yourself as well because you need help in those situations. It is so frightening to be alone or thinking that you're alone in those situations, whereas you don't have to be at all. There are people that will help you. There are people that will support you supporting your loved one, and that's how it works.
So be aware of the pressure cooker that could become your life as a caregiver. I can't be so focused of relieving the pressure that is your life as the person with cancer that I forget to release the pressure in my life as well. Because then if I'm not looking after myself, how can I look after you? I need outlets in my own sphere so that when I'm dealing with those difficult things, I can take more on, I can be engaged and present and helpful.
Exactly right.
Because if I'm in a terrible space, I can't be the pillar that you can lean on.
You're kind of not much use to the other person.
Sure. If you do find yourself in the role of a caregiver and you have any questions or you need to reach out to someone with experience, we're very fortunate to have Rowan. She's got over 30 years of experience in guiding people with cancer, in being a caregiver. We are able to answer your questions. Please leave them in the comment section below. Follow the link in the description to our website where you can engage with us on a more private and personal method. We're here to help you. We're all walking on this journey together, and we'd love to engage with you if you would like to. Thank you for watching the video, and we'll see you in the next one.